the CT.
Mm-hmm.
And so the common causes of arterial venous pulmonary shunts aren't there. But I've seen a couple of people who have some really incredibly fine shunts that came on kind of in middle age. Now, you know, clearly, when there's primary lung disease causing low oxygen level, you know, there's a bunch of stuff that, in terms of the need for oxygen, that we're pretty strict about. When is oxygen due to shunt, that is the lung that's bypassing the lung, it's much less of a concern, more of a concern just for symptomatic stuff. In other words, but in terms of what's going to happen to this lung, how bad is the shunt going to get, and all those things. Since you don't have liver disease, we don't have another reason to believe there's going to be, that this might progress that much. And so then the question comes, first of all, we need to prove that my current guess is right. so we'd like to be able, the echo study they did that showed the bubbles come across, that's very reliable for there being a communication between the right heart and the left heart that doesn't go through past the alveoli. But it is absolutely useless to tell you how much. Now, from the amount you desaturate, I'm guessing, and I ought to get out pencil and paper and figure this out, but I'm guessing you're going to have about 10 to 15% of the blood shunting past your lung. Now, the main reason, I'm jumping all over the place, so please stop me any place you want. The main reason it's really important for us to give oxygen to people who have low oxygen because of their lung disease, like with cystic fibrosis or chronic bronchitis or COPD, is that that prevents the resistance in the lung from clamping down, and so that the right heart is not pushing against a huge load. In fact, your right heart by the echo is perfectly happy, and your vessels are not clamping down. Clearly, though, some people will, and a lot of people do get symptomatic when the saturations drop low. There's a lot of variability among all of us in terms of how tolerant we are of low saturations. Some people, and this is just basically who your parents are, and we inherit that sensitivity. So some people can work comfortably with saturations of 82 and 84% and simply don't notice it. And other people feel quite out of breath with it. And so that's a separate thing apart from the lung. That's how sensitive your body is to the low oxygen level.
Right.
And for instance, people who are altitude dwellers, we were just talking about Leadville, Colorado, which is 11,000 feet. A lot of studies have been done on the people up there. Everybody walking around Leadville has saturations 84, 85% all the time because they're living and working at altitude. They do not have underlying lung disease, and so they all do just fine. So what we haven't proved with you, and I'd like to be able to demonstrate, is to be able to say, okay, if we do a regular old-time lung scan, which is what we used to do looking for blood clot in the lung, we can also see if the stuff we inject, the technetium, if it gets past the lung, that tells us it's going through some bigger channels that should be there. We can actually get a number. We can actually say, okay, this is a 15% shunt, say, for instance. And so that would say something about the size of the shunt. Because, for instance, if we were to do that test and it comes out within normal limits, then I've got to somehow look hard for other lung disease that we're somehow missing. You know? So that's the reason I would like to see that done. And then I think a reasonable question is what next? Well, the other issue I wanted to ask our radiologists if there's any other study they might be able to do with our current CT technology, which is phenomenal, in terms of looking at the very small vessels. If they can time it, they can time the thing so the dye is going right through the pulmonary artery vessel. Let's ask Sudhakar about that.
Yeah.
We just had our hands on him 2 hours ago. We'll catch him again. but I thought it makes sense to first do the nuclear medicine study. And if it shows what I think it's going to show, then I think I'd like to recruit our top chest radiologist to find a timing for the dye to see if he could possibly distinguish, because the one comment he made about the CT we've got from Swedish is that the vessels of yours that are farthest out still show pretty big, which is kind of interesting. They don't usually do that. They're usually kind of wafer thin by the time they get to the edge of your lung. And so again, that's suggestive at least that there may be some little tiny communications that don't show up even with today's standard CT technology. But Sudhakar may be able to do something with his machines to show that. But anyway, first step would be to say, okay, is there really the shunt there that we think there is? Because if we find out that's in normal limits, then we've got to go back with some pulmonary function tests and stuff and say, okay, what are we not seeing here that we're not seeing in the CT?
And the brief pulmonary function tests we got here today look okay. They're kind of just part of what we usually do, but it's what we're able to do in
Because I was
clinic.
telling him that the one I did before that you were asking about was I was in a box.
Yeah.
This was like easy compared to that one.
Yeah,
Yeah,
would love
because
we would love to get a hold of that stuff.
we would love a box
Because
of
that's the other
but
question
we'll
is
get
about,
that stuff from
is about
Dr.
how
Husby.
long ago were those done? Ones that
I
been
want to say they were October.
Okay.
Most of my testing is October and beyond.
Okay, great, because I'd love to get a hold of that stuff to see if there's been any suggestion of progression at all. Because the other thing is, obviously you weren't like this, I understand it was kind of incidental that you first found this out, just playing with an oximeter and it alarmed on you, you know?
Yeah.
And so, that's the, and again, you know, without more specific pulmonary symptoms like, you know, cough or burning chest pain and all those other things, this is just this thing where you desaturate.